Hey, everybody, welcome to Pep Talk, the podcast that gives you the truth, the whole truth, and nothing but the truth. So help us, God. We're here to give you some simple breakdowns of these complex medical conversations and health and wellness conversations that we're hearing about on social media. You hear about on the news, you hear about from your friends and family, and sometimes you may even hear some of these from your healthcare practitioners if they're hip to what health really is. So, folks, today, on this journey, I'm going to take you down. I'm Dr. Eric Naputi, your host. I'm going to take you down this journey. We're going to talk about peptides today. I know a lot of you have been asking questions about peptides for athletic performance, peak performance, and things of that nature. So let's break that down and let's get into that conversation today. Let me give you a disclaimer. What I need you to understand is this, is that just like a lot of new compounds that are on the market, there may not be a lot of regulations on it yet. There may not be a lot of great resources on it. So you've got to find trusted sources to decide what's best for you to do. I believe that we are doing a phenomenal job giving you this information, but go and do your own research, right? And understand also that things like peptides have been around for a long time. I mean, peptides have been around since the 1930s, 1940s. The Russian scientists utilize these to help improve the health of their soldiers and their citizens. So there's a tremendous amount of data, but just like many things that are out there that are outside the purview of, big pharma or medicine, because there's not any global patents, because the pharmaceutical industries can't patent these naturally occurring compounds in the body, they want you to believe that they're not safe, they're not effective, and et cetera. That's not true. In fact, almost every peptide has been generally recognized as safe. Just like anything, if you take too much of a good thing, it can cause problems. That also is a fact. So organizations like the World Anti-Doping Association, the NCAA, MLB, NFL, NHL, PGA, all these organizations, you're going to have to check with them to see if these peptides are suitable for you. I will tell you this, that in the next couple months, there's going to be some very favorable rulings that are coming out that are going to lift a lot of the restrictions on oral consumption of peptides globally. Why? Because they're safe, they're effective, they're natural, and the demand is there. The problem is that lobbyists, big pharma, and the powers that be are trying to figure out a way to capitalize on these so they don't lose market share. So you need to figure out how to maneuver through the minutia and the BS to find out what's best for you, your health, and the health of your family members and loved ones. So let's talk about peptides for athletic peak performance. Now, I'm a functional medicine doctor, former athlete who works with athletes on a collegiate, professional, and Olympic standpoint and everything in between. And I've been working on helping peptides be utilized with peak performance for almost 20 years now. And we know that the foundation of all athletic success is really proper nutrition, proper training, and proper recovery. If we can have the right nutrients, the right training, the right recovery, you have the right mindset and the right coaching, well, you can accomplish many, many things. Listen, if you're an athlete seeking new ways to maximize your peak performance physically and chemically, peptides are something that you need to be aware of. Now, before we dive into all these peptides, please understand that different organizations look at these with different legalities, and most importantly, they have an impact on the World Anti-Doping Association says certain peptides are not to be used. So if you are participating in any of those organizations, you need to first look at what is allowed and not allowed. And by the way, there's going to be a lot of changes real quick happening. So what are peptides? Peptides are the basic fundamental building blocks of proteins, made up of unique separate amino acids that determine their specific shape and function. And I always tell folks these little amino acids are like a chain. And they can be as little as 2 amino acids or as big as 200 amino acids. And they all do different things in the body. It's kind of like a code going into your computer. And these peptides can help with tissue repair, muscle growth. They can help reduce chronic inflammation, which can help you deal with pain better and more effectively. They can also help with hormonal regulation, which, again, as an athlete, proper training and proper recovery, and recovery is huge. So first of all, before we talk about peptides, if you haven't done, and you're an athlete, if you haven't done a molecular genetic test, a swab or a spit test that measures your single nucleotide genetic polymorphisms and tells you how you should eat, how you should sleep, how you should exercise, how you should recover, you need to run one of those, because that's how you can base your lifestyle, including your training, including your recovery, off of. And then you can decide what peptides are best for athletic peak performance. So, all right, let's get into this. In cases like mine, like a former athlete, I'm really focused on keeping my growth hormone up, my tissue repair up, and my inflammation down. So peptides that are all about growth hormone releasing peptides, and peptides that can improve that, are really going to help hormone production, which is going to increase muscle mass and overall strength. So here's a list of the best peptides for athletes. All right. So number one, best peptides for endurance and stamina. Okay, thymosin beta 4. TB4 is the name of it. TB4 works by binding to actin. Actin and myosin are in your muscles, and it mobilizes stem cells and other cells to come to that area. So it's gonna get a lot of fluid, a lot of cells, and a lot of blood to go to that area. That can cause hypertrophy. Well, that can cause muscles to get bigger. We want that. TB4 also reduces fibroblast, which are the cells responsible for tissue healing. Why is that important? Because we don't want too much tissue to go there, because we get too much tissue, we get scar tissue. That's a big problem. That's a big problem for athletes, for injury repair, for recovery repair from your workouts. And if you had surgery, if you're just a regular old Joe or Jane out there like me, and you've had surgery, well, one of the side effects of surgery is too much scar tissue. So it can help with that. Even outside of the world of competitive sports, I'm a huge fan of TB4. By the way, one study in the Journal of Cryotherapy showed TB4 helped patients with acute ST segmental elevation. That's a myocardial, that's a heart problem. So it's been shown to help with heart function, which is a big issue with athletes. We're seeing now more in the last 4 or 5 years, athletes that are passing out on the field. They're having myocarditis, other cardiovascular issues that we've never seen before. All this vasovagal POTS type syndrome, TB4 has been shown to be able to help with some of those issues. Here's another one. AOD 9604, which is anti-obesity drug, is what it stands for. For many people, being overweight and inflamed is like having gasoline on a dumpster fire. And this compound helps the body naturally lead towards burning off fat and getting rid of a lot of toxins. That's a big deal. So anti-obesity drug is a peptide that really is synonymous with growth hormone. It helps achieve weight loss, fat loss, and helps build muscle faster. AOD is an amazing nutrient for athletes. One of my favorite peptides of all time, and I think is the best peptide for injury recovery, is BPC 157. That's body protection compound 157. It's made up of 15 amino acids. It's really amazing, and it's naturally occurring in the gastric juices of humans. This peptide has been shown to promote healing and cell regeneration, primarily through what's called angiogenesis, which is production of new blood cells, new blood vessels, new pathways for blood to flow, which is how cells and nutrients get to tissues in the first place. BBC 157 also helps with bone to tendon damage healing. We see that in a lot of our athletes. It's where a lot of joint pain comes from. It's where a lot of popping and clicking in joints comes from. Not only do I see that with competitive athletes, but I also see this with, like myself, weekend warriors. You know, we go out and we overdo it with our Krav Maga classes or our weight training or whatever it is that we do to keep us, you know, young at heart, right, and young at body, but we feel it the next day. BBC 157 helps reduce that process, and it helps healing with ligaments and reduces inflammation and boosts collagen production. Another one is TB 500. Thymosin beta 4 is really good, but TB 500 is a isolate from that peptide. It has regenerative properties that helps athletes recover soft tissue damages faster and helps with muscle injuries. It's really good at restoring and maintaining cell structure, speeding up healing and repair in tissues and injuries, not just from, you know, sports injuries, but even wounds as well. If you're a slow wound healer, I have a lot of people who are diabetics and they get diabetic ulcers. We put them on BPC 157 and TB 500, and it really seems to help speed up the healing of those wounds. So that's a big one. CJC 1295. CJC 1295 is a peptide that is very similar to growth hormone releasing hormone, so GHRH. It's very popular for boosting muscle mass and strength. It works on the pituitary with the production of growth hormone, which I'm going to tell you is, again, it's the fountain of youth. The better you have this, the better the fountain of youth is. This deals a lot with protein synthesis and repair of damaged tissues. Okay. And when you go and you work out in the gym, the reason why we recommend for most people, the last set they do go to failure or close to failure, because we want to get little micro damages, micro tears in the tissue, but we need the protein, and then we need the worker bees to grab the protein, which are peptides, and put those tissues to repair. That's how muscles get bigger and stronger. You have to work to failure. If you keep doing the same workout every day, you're going to get a benefit, but not as beneficial as you work to failure. All right, a couple more. Let's talk about MK677. MK677 stimulates the pituitary gland to enhance the production of growth hormone. All right. It's very similar to CJC in that manner. Some people prefer MK677. Most of the people I work with use CJC 1295, and they do really, really well with it. It takes about 6 months of your body being on peptides for your cells really to start making long-term changes. People notice feeling better pretty dang quick. But anyway, it's these working couple peptides together is really the right combination formula that you should find. By the way, let's talk about peptides and doping regulations as an athlete. I kind of talked about this some. If you go to WADA, the World Anti-Doping Association, it's going to give you a list of prohibited substances that are on there. You need to check that out, okay? Now, understand that that's changing. There's a lot of conversations because athletes deserve to have the same amount of healthcare that non-athletes do. In fact, I'm going to say that they need it more, because the tearing up and tearing down of the body as a high school, college, or professional athlete or Olympian, or even a weekend warrior, has those long-term effects on your body. And there are things that can be done now to help mitigate some of those long-term problems. But it's best to seek advice from those organizations. If you're in the NCAA, find out what they recommend. If you're in high school, find out what your high school association allows you to use. Most peptides are allowed, but you got to be aware of that. Let's talk about peptide benefits over steroids. Peptides really have emerged as a very popular alternative to steroids in the last, really, I'd say, decade. For one key reason is because there's not a lot of toxicities. There's not a lot of side effects. I do testosterone therapy. I have a lot of my patients that do it. I have a lot of my female patients that use hormone replacement therapies as well. I recommend the bioidentical form of that. The synthetic form is a little bit more problematic. It lives on the receptor site longer and has a higher chance of an infinity of toxicities and problems. But bioidenticals don't. And the latest research shows that elevated testosterone levels can actually reduce the risk of heart attacks, improve longevity. I mean, so we are now finding out so much more information. The powers that be that tried to suppress the information about testosterone therapy 20, 30 years ago cannot no longer suppress. We need to get out in front of the whole idea with peptides, because they're trying to do the same thing with peptides. They're safe, they're alternative, they're effective, they're generally recognized as safe on most playing fields, but the powers that be are trying to regulate it so that they can make money off of their other drugs and therapies, which is disgusting, but it's the truth. And so best practices for athletes and bodybuilders using peptides is, always use, proper nutrition, hydration, exercise, have the right recovery, have the right rest, have a holistic foundation of eating well, sleeping well, thinking well, breathing well, moving well. Do a genetic profile to find out where your genetic profile is, how you should sleep, eat, supplement, etc. Run a stool sample to check the bacteria in your body, run blood levels on your hormones and inflammatory markers, and then either get information yourself through the right, sources, or work with functional medicine practitioners or healthcare practitioners that can help you really navigate what you should be doing. And don't just throw a bunch of spaghetti against the wall and hope to God something works out. Like, let's have a strategic plan. And when you put a plan into place, stay with it. You got to stay with it for at least 6 months. What you consistently do over time gives you a result. If you do the right thing over the right amount of time, you get a positive result. You do the wrong thing over a long enough time, you get a negative result. Most of us, including myself, are screwed up because of the months, years, or decades we've done the wrong thing, and now we've got to repair all that. And it takes at least 2 90-day cycles for your body to really start changing the way that cells are produced in the body. And every 12 to 24 months, our body regenerates itself. New liver, new skin, new organs, new everything. But you got to have those cells signaling properly. So you got to stay consistent with the work that we're talking about. So folks, that a lot of great information for you athletes out there that have been asking me about that. Go back, rewatch this Pep Talk podcast, share with your friends and family. Don't forget to like, subscribe, check out all of our social media platforms. If you're using some of our recommended therapeutics and etc., tag us on social media, right? I am Pep Talk, or go to peptalk.world. That's peptalk.world to learn more about it. So folks, till we meet again, I'm Dr. Eric Naputi. God bless you. God bless America, and God bless the world. Stay smart out there, folks, and we'll see you next time. Have a blessed day. Be well.